today we hear a lot about the prebiotics and probiotics. Now, unless until the concept goes inside, I think the usage also, when we use a probiotic, it's just because we are hearing that we have to give something, we are giving without any conviction. So that is more important. But why the probiotic? That is important, I think. So we need to go into the depth of the understanding of gut microbiota. Now, when I was trying to search, what are the studies going on, we keep hearing that this is a new concept. In 2013, this is only in 1 year, there was nearly 14,000 results. Deep-seated research is going into the gut microbiota concept. What we used to say genetic will slowly turn into gut microbiota. Each and every individual with trillions of cells in the body, and the huge largest organ is the gut microbiota in the individuals. Now they have seen that each and every individual have their own thumbprint. Like our thumbprint doesn't match with any individual, simply a gut microbiota will also not match with other individuals. And that ratio, the relationship, the sequencing which is done with the genomic study, the metagenomic study, will determine what disease the child will have, what disease the child is going to have, starting from Barker theory to end of even the cancer, they are determining by the gut microbiota. Now if you see what is there in the studies, even the gastrointestinal symptoms which the infants are suffering, a fussy child, a crying child, regurgitation, vomiting, infantile colic, they see there is a relation with this part. One interesting thing, we keep on hearing stem cell transplant, bone transplantation. Now there was a study which they have showed the fecal microbiota transplantation in a case of recurrent Clostridium infection. So to that extent it is going on. The current concepts and the future direction, it is considered as a superorganism, and you see that the particular focus, they have seen even the inflammatory part which takes care of all the diseases, the cytokines, the chemokines, all these are related to the alterations in the organisms, in the flora, which we used to say, now we have a concept of the flora, gut microflora. Now we heard about the obesity and maybe about the metabolic syndrome and microbiota. This gut microflora has diverse organisms and is responsible for digestion of the complex carbohydrates, and it does colonize. They have done studies with germ-free cell and with germs mice, and they have found that there is a difference between the gut microflora of the lean mice and the obese mice, and that it is transmissible. If you transmit the obese mice gut microflora to the lean, it changes. And it is seen that there is a deficient in the toll-like receptor which is responsible for hyperphagia. So one child, we hear that one child, what you were saying, is obese, takes more milk and becomes obese. The other child doesn't become. So maybe a time will come when one can do a sequencing study and find that there may be an alteration in the gut microflora. We know that the intestinal microflora have trillions of cells. If you can see the distribution, the more you go in the upper part of the gastrointestinal tract, you have a lesser number of microflora. The lower down, you see you get more and more of the microflora. So the diseases also takes place in the lower gut. Now, what is the role of our pediatricians? When we are hearing about the concept of gut microflora, what role can we play? It is not a predetermined thing. It depends on the association, because a fetal is developed as sterile. It has a sterile gut. Now slowly with the environment, the first is the environment, how the birth canal has the colonization, that depends on the first part. So the gut microflora of a child will vary from the mode of delivery. If it is delivered through the vaginal canal, you have a different colonization, much better colonization. If it is delivered by cesarean section, it gets the hospital environment, so the colonization hampers. It takes longer duration to get the adult colonization or the good colonization. It depends on the skin. Skin is the largest body of the mother of anybody. So the mother skin colonization, the birth attendant skin colonization. So there comes the concept of washing hands. And you have breast milk also. Breast milk can also give rise to gut microflora concept. So important is mode of delivery. We have to ensure that early feeding methods, we are aware of that. Gestational age is important. Probiotics. Now if you go back into the ages of paleo diet, which Dr. Ghosh was saying, in paleo diet, I'm sure there are a lot of studies which have shown that gut microflora also varies with your diet. So in those days, we never had so much of diabetes, we never had so much of cardiac problems. The reason was they were at the inflammatory and the anti-inflammatory balance is much better if you have a very good gut microflora, which is influenced by the diet. Antibiotic is another very, very important thing which is in our hands. So I would request, if you get the concept of gut microflora, this is an intangible thing. What is doing a treatment is a tangible benefit. We give antibiotic, we see that the fever comes down. We don't want to wait to see whether it's a viral or bacterial. Now today's concept with this antibiotic has come down, we can step down on our antibiotic. In a very critical case, you may start with a high dose, high antibiotic with a broader coverage, but slowly you can see if the disease is focused, if you get a culture or the clinical finding is focused, you can step down on your antibiotic. So at least you give some savings to the gut microflora. So as I said, one should take care of the delivery mode, antibiotic usage. Another concept we had, weaning. 6 months, WHO was preferring that we should start weaning after 6 months because of the gut microflora, and baby's immunity depends on the gut microflora. But today we are seeing even it has come down to 4 months because they are seeing the sensitization. If you use early weaning with cereals, the celiac disease incidence is becoming less. So that was some studies which have shown that. So the decreased gut microbiota diversity, delayed bacteroidetes colonization, reduces the T helper responses in infants delivered by caesarean section. So this was a 16S sequencing, a very highly technological advanced studies which have shown that definitely you have all the cytokine releases are less, and automatically the balance between the inflammatory and the non-inflammatory part is very maintained, which helps in the total allergic manifestations which a child is having. The amount of autoimmune disease increasing is again one of the fallout of this issue of altering the gut microflora. So the gut microbiota and the immune homeostasis, this was one of the last studies just published. Whether it is colonized at birth or adulthood, does it matter? It really does matter. So once you can take care of the baby right from the day one, it really matters, if not in the prenatal period. Thank you.